The other day, I was reading someone's blog, and they were talking about their daughter during her cancer treatment. And they kept mentioning how helpful it was that she got to work with the child life specialist and do different things with that person, and that helped her a lot. So I became really curious of what a child life specialist was. When I went to childlife.org, the one place that you can get the certification, I learned a lot. A child life specialist is someone who works with children, usually those in hospitals, but they also can work in outpatient clinics, specialized summer camps, court systems, and funeral homes. And they help kids be kids. I didn't contact anyone for this career because I didn't know anyone that does it. It's not the most common career ever. The organization I was thinking about was the Boston Children's Hospital in Boston, Massachusetts. I was thinking of Barbara Bush as well. Barbara Bush is in Maine, and they kind of work together. As I mentioned, child life specialists usually work in hospitals, and their hours are often between 7:30 a.m. and 7:30 p.m. But people working in pediatric emergency rooms will usually have evening hours as well, and some nights and weekends are required because sickness doesn't take a break. This can be a really stressful career because you're working with sick children. So you're going to have to deal with a lot of sickness and regularly be confronted with death. It can be really psychologically taxing. Also, there's a lot of things that need to be done and a lot of people who need your attention, so that can pull you in multiple directions as well. The typical benefits that a child life specialist receives is there's usually health, vision, and dental benefits with the job. The salary usually ranges around $40,000 as a mean for a starting salary, between $37,000 and $50,000, and then for an experienced salary is $60,000 to about $86,000. The educational requirements of a child life specialist is actually a bachelor's degree, which is exciting, and at least 10 credits have to be in a field relating to child life. So social work, psychology, family studies, child development all count. You need to do a 480-hour internship in the child life field before you can sit for the exam. And after you take the exam and you pass, you can get your certification. They're going to change that. They're working on changing that policy effective in 2025, but starting in 2022, where a master's degree is going to be required in order to be a child life specialist. What child life specialists do, I mentioned earlier, is they help kids be kids. They plan parties and activities and concerts for children in the hospitals. They staff the playrooms and have different activities for the children to do, including like arts or crafts. And they also give the preparation for the procedures, the non-medical preparations, such as explaining to the kids in language they can actually understand what's going to happen to them. And they can sit with the children to support them through those really scary procedures. Child life sounds like it would be a really interesting career because you're working with children when they need it most, and you're helping people. The downfalls is that it's really competitive to find physicians because they're not that common. Thank you.